Page 13. Q. Which of the following best describes the language of a 24-month-old? A. Doesn't understand. Yes and no. B. Understands the meaning of words. C. Able to verbalize needs. D. Continually asks why to most topics. Rationale. Children at age 2 can reach for objects that they desire and use simple words such as cookie to express what they want. They already understand yes and no, so answer A is incorrect. Simple language patterns begin to develop after this age, even though children at this age might understand some words. Therefore, answer B is not a good choice. Later, at about age 3 or 4, they begin to ask why, making answer D incorrect. Q. Which of the following medication orders needs further clarification? A. Darvocet, propoxyphene, 65 mg po every 4-6 HRS. PRN. B. Myceline, primidone, 250 mg potid. C. Coumadin, warfarin sodium, 10 mg po D. Premarin, conjugated estrogen 0.625 mg po daily. Rationale. There is no specified time or frequency for the ordered medication. Answers A, B, and D contain specified time and frequency, therefore they do not require further clarification. Q. Select all of the risk factors that are associated with deep vein thrombosis. A. The use of oral contraceptives, obesity. B. Type B and O blood. C. Rh negative blood. D. Nulliparity. Rationale. The risk factors associated with deep vein thrombosis are oral contraceptive use, obesity, hormone replacement therapy, hypercoagulable states, old age, type of blood, multiparity. Not nulliparity, and among clients who have had major surgery and/or prolonged immobility. Types B and O blood, Rh, negative blood and leukemia are not risk factors associated with deep vein thrombosis. Q. The client is admitted to the chemical dependence unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because A. Hallucinogenic drugs create both stimulant and depressant effects. B. Hallucinogenic drugs induce a state of altered perception. C. Hallucinogenic drugs produce severe respiratory depression. D. Hallucinogenic drugs induce rapid physical dependence. Rationale. Hallucinogenic drugs can cause hallucinations. Continuous observation is ordered to prevent the client from harming himself during withdrawal. Answer A is incorrect because hallucinogenic drugs don't create both stimulant and depressant effects. Answer C is incorrect because these drugs do not produce severe respiratory depression. Answer D is incorrect because these drugs produce psychological dependence rather than physical dependence. QA post-operative. Client has called the nurse's station with complaints of pain. The first action by the nurse should be to A. Check to see when the client received pain medication. B. Administer the prescribed pain medication. C. Notify the charge nurse of the client's complaints. D. Assess the location and character of the client's pain. Rationale. The nurse should first assess the client to determine the location and character of the pain. Answers A, B, and C are incorrect because they are not the first action that the nurse should take. Q. Which laboratory finding is associated with HELP syndrome in the obstetric client? A. Elevated blood glucose. B. Elevated platelet count. C. Elevated creatinine clearance. D. Elevated hepatic enzymes. Rationale. The criteria for HELP is hemolysis, elevated liver enzymes, and low platelet count. In answer A, an elevated blood glucose level is not associated with HELP. Platelets are decreased in HELP syndrome, not elevated, as stated in answer B. The creatinine levels are elevated in renal disease and are not associated with HELP syndrome, as stated in answer C. Q. The physician has discussed the need for medication with the parents of an infant with congenital hypothyroidism. The nurse can reinforce the physician's teaching by telling the parents that A. The medication will be needed only during times of rapid growth. B. The medication will be needed throughout the child's lifetime. C. The medication schedule can be arranged to allow for drug holidays. D. The medication is given one time daily every other day. Rationale: medication will be needed throughout the child's lifetime. Answers contain inaccurate statements, therefore, they are incorrect. C and D. Q. Damage to the 7th cranial nerve results in a facial pain. B. Absence of ability to smell. C. Absence of eye movement. D. Tinnitus. Rationale: the facial nerve is cranial nerve 7. If damage occurs, the client will experience facial pain. Answer B is incorrect because the olfactory nerve is responsible for smell. Answer D is incorrect because the auditory nerve is responsible for hearing loss and tinnitus. Answer C is incorrect because eye movement is controlled by the trachea or C4. Q. The client is admitted to the unit after a motor vehicle accident with a temperature of 102 degrees Fahrenheit rectally. The nurse is aware that the most likely explanation for the elevated temperature is A. There was damage to the hypothalamus. B. He has an infection from the abrasions to the head and face. C. He will require a cooling blanket to decrease the temperature. D. There was damage to the frontal lobe of the brain. Rationale: damage to the hypothalamus can result in an elevated temperature because this portion of the brain helps to regulate body temperature. Answers B, C, and D are incorrect because there is no data to support the possibility of an infection. A cooling blanket might not be required. And the frontal lobe is not responsible for regulation of the body temperature. Q. Young children living in housing that was built before the 1970s are at risk for A. Lead poisoning. B. Pernicious anemia. C. Iron poisoning. D. Sprue. Rationale: before the mid-1970s, lead-based paint was used extensively. Children living in housing built before that time are at risk for lead poisoning. Answer B is incorrect because it is due to a lack of intrinsic factor needed for the production of red blood cells. Answer C is incorrect because it is related to the overuse of iron supplements or vitamins containing iron. Answer D is incorrect because it is related to the ingestion of grains such as oats, barley, wheat, and rye.